The scientist's conclusion relies on which of the following assumptions? What is their conclusion? Here we have, the scientists conclude, it's nice when the language matches up, the scientists conclude that the heart protects against both physical breakdown and depression. So they are saying that let's see, how should I do this? As heart goes up, that equals an increase in physical and mental health. So that the correlation goes this way. As the heart rate goes up, physical and mental health also go up. So so when you need to verify the assumption, I mean, sometimes you look for terms that appear in the conclusion that don't appear in the evidence. The other way that you think about the assumption is that their conclusion really is correct, that there's not some other relationship. So when they are making a conclusion about a causal argument, the assumption is that they've got it right, that they're not missing something. So again, with a causal argument, that's the sort of thing we would be looking for. Let's look for that. A, high heartbeat protects against depression better than normal heartbeat. Well, all we know is that high and normal tends to be better. We don't actually need to differentiate between high and normal, so this is not an assumption. B, depression has effects on the body similar to those of physical breakdown. Well, if anything, this is an argument in favor of the heart affecting both of them, if they both have similar effects. C, patients who have high heartbeats cannot develop depression. That is not something the scientists are assuming. All they say is that there are lower incidences of depression with those with normal or fast heart rates. Are they assuming D, depression does not cause heart rates to decrease? Well, we'll keep this one here because that's a possibility which we can come back to. E, psychiatric treatment of depression is less effective than treating physical illnesses. We aren't dealing with the treatment of these things, only about this correlation of the heart and physical and mental well-being. So let's get back to D, which obviously must be the right answer, but let's talk about why that is. So one of the assumptions, when you have a causal argument, remember when you need to weaken a causal argument, the three ways you do that are you either say, no, X doesn't cause Y. You say, no, it's actually Z that causes Y, not X. Or you say, actually, the relationship is reversed. It's actually Y that causes X. And that's what D is doing. We're assuming that it's not, in fact, poor mental or physical health that causes a lower heart rate, rather than a high heart rate improving physical and mental health. Basically, choice D, the assumption is that it's not going the other way. And therefore, that's the answer.